Welcome to the 2023 Road Warrior Recognition Awards. My name is Carissa Brewster, staff writer for Whitman Partners, and today we have Wayne Mcfatter, who is the Interim Executive Director of Surgical Services at FirstHealth Moore Regional Hospital in Pinehurst, North Carolina. Welcome, Wayne.
Good morning. Thank you. Thank you for having me. You know, when I was changing careers, I was thinking about what I wanted to do next, and was it getting back into a health system? Was it doing interim? Was it doing consulting? So dabbled a little bit into consulting, then I had the opportunity to come into interim to give it a shot, and I luckily had some good connections down here, and they requested that I come down and give them an interim role for a few months. So I said sure. So since I've been down here, it's been a great experience. So thinking as an interim, you kind of come in as a really as a unofficial consultant because you get to come in and see the opportunities that lie before you, and then have the opportunity to make things better. So I think interims have their place, and I think it's a great way to bring some fresh eyes in, so you can come in and see what's going on in the organization. Well, I think one is your experience. So, whether you've been an executive director or director for a long time, or if you've been doing interim for a long time, I think you want to definitely bring out your experience level and things that you've seen at other organizations and things you've been able to take in and to improve. So, of course, in the interview process, you want to sell yourself. Bring in your strengths, and I think as an interim, or permanent, again, going back to that fresh set of eyes. So learn as much as you can about the organization before you sit down for interviews. And I think in this situation, I was brought in as a consultant first, so I was able to get a kind of a leg up to see what was going on there and look at they'd asked me to come in and look at their revenue cycle and look at their block utilization and management. So that are two biggest things that any organization wants to improve on, especially in any OR, is utilization, throughput, management, and of course, absolutely revenue. So definitely selling yourself on your strengths. You need to touch on your weaknesses, things you're working on, but definitely sell yourself on your strengths and what you bring to that organization, whether it's going to be for 13 weeks or it's going to be for the rest of your career. So either way you look at it, interim, permanent, those two go hand in hand. That selling yourself and talking about your strengths and what you can bring to them. Definitely with the culture of the organization. What is their level of transparency and the phrase catchphrase now is just culture. Are you a just culture organization where you look for opportunities to improve quality? So in order to improve quality, you gotta admit when you fail or when you make a mistake. And when you do make a mistake, how does your superiors handle that? Do they is it a hand down or is it a fist down, blaming culture, or is it a culture of accepting mistakes and learning from mistakes and improving on that? So just culture in the organization is probably the number one. Second is the volumes. Are your meeting expectations with your utilization and bringing on new volumes and improving volumes? And then thirdly, um, a finance person would say that's number one, but is revenue. How strong is the organization? Are you meeting your budgets and meeting your bottom line? And if not, what are the plans to get that back in order? So those kind of top three things, depending on who you're talking to, like the finance person will say that's number one. But number one is taking care of the patients and making sure patients can get through and safe, and um, that you're practicing a culture of transparency and learning from your misses and learning from mistakes. Number one is you want to meet with your immediate supervisors to set the ground rules. When I say ground rules, I ain't really rules. It's just expectations. Um, this is why I'm here. I'm not here to upset the apple cart. I'm not here to turn the world around or make a lot of people's life miserable. I'm here to make their life better. Um, your supervisors and my supervisors are my first customers, and staff are my customers, and then physicians. So you're coming in um, not like a bull in a china shop, but for the first few days, I like to say it's walking in your shoes. You go in there, go into the OR rooms, and spend time with the staff and the surgeons that let them know that that you're here to help, whether that's in the room, whether that's, HR help, whether it's culture help. So, just spend time with the staff, spend time with the leaders, and take it, baby steps in the beginning, so they're not fearful, because they're going to wonder why you're back there, and you just set their mind at ease. I'm just here to learn your flow, learn how you do things. There's a million ways to do things, and I want to learn your culture and your workflow. And so I'm not coming in here and trying to change everything without understanding the why behind what you're doing. Yeah, accessibility is probably the number one problem in most ORs, because the volumes are out there, especially the hospital volumes and inpatient volumes, and that sometimes translates over to surgery. For the most part, most surgeries are busy, but there's always opportunities to increase that volume. And number one is access. So breaking down those barriers of access and visibility to the schedule. Um, Many organizations do not have the capability or have the ability to allow offices and surgeons the visualization of the schedule. So they don't know what they don't know. So I know most surgeons have block, but however, there's more oftentimes than not, they need to work outside their block, and they need to see what that availability is. And that visualization is a barrier. It's a roadblock. So that's when ORs go unused, time goes unused, rooms go unused, because then, unless you're sitting on the phone calling every surgeon, hey, I got this time available, that's not going to happen because you don't have that time to do it. But if they don't have access to the surgery, they don't have visualization of the schedule in order to get those additional cases on, that's a major roadblock. So anything you can do, whether it's technology, to make that access more available and more accessible, the better. And that will definitely bring in the additional volumes to increase the revenue. One of the big challenges right now with hospitals is the nurse travelers and the tech travelers. That is eating up a lot of the revenue. So if you're able to create positions in your organization where you can bring in additional new grads or people that can learn through Periop 101 or things like that to increase your staffing, because that's probably the number two thing that's driving revenue down, or eating some of the revenue up, is the amount of travelers that the ORs are having. So they're having to bring in all these folks to manage that volume. So it's kind of a double-edged sword. Do I bring in all the travel staff to meet the volume, or do we cut rooms in order to decrease the travel staff? So it's kind of a double-edged sword, which wins out. Most of it, what we're seeing right now, the volume wins out, so we got to bring in additional staff. So the ability to grow and create your own OR nurses, because there's not a lot of experienced nurses out there to pull from. So right now we're having to bring in new grads and transfers from other departments, to train them, and then get them into the OR to help offset that travel expense to get that volume to come back, to get that revenue to come back.
Right. So you're saying that the volume is out there, but it's difficult to get experienced nurses in there to handle it. And
Exactly.
so you're saying you need to, so we need to grow and nurture the new grads instead of.
Yep, exactly. That's when I talk to people across the country, they're having to do this. They're not getting the experienced applicants. They're getting grads wanting to come into the OR. So having a formalized training program, typically Periop 101, onboard those new nurses. So you're talking about from pre-op, from the time this case is scheduled to the time they go home?
Yes.
So, yeah, a lot of organizations, not fight this, but try to fix this and try to work on this. But the ability to bring patients in preoperatively for education and make sure they're prepared for surgery, that goes a long way for the whole surgical care continuum. So you'll hear terms like surgical home or ERAS programs, but they all boil down to how do we onboard the patient sooner. So as soon as they're scheduled for a case, how can we get them educated and trained and brought up to speed prior to surgery, and then following through surgery, and then of course that now actually extends it to the home. How do we prepare their home for the patient to recover better? So you'll hear the term surgical home. That's fastly growing across the country. Um, from time they're scheduled, they get in touch with the pre-op nurse team, pre-op evaluation team, where they're evaluating their health history, getting them lined up with consulting physicians, getting all that done, anything they can do to get it done in the beginning. And then of course that makes it flow through the surgical arena, and then of course back to their home. So those are some of the things that a lot of hospitals are implementing, and it definitely has its pluses, on the backside. So to touch on case cancellations first, so definitely been able to have the ability to track, and it's usually same day cancellation. When cases cancel, when you have further out, you got time to recover, but when cases cancel the day of, you're right, that room is sitting idle. That staff is being non-productive. They're having to wait for the next case. So number one, having the ability to track that and see what those problems are. Is it on the pre-op teaching side? Is it on the medicine side, where they're not being properly evaluated for surgery? Where your problems coming from. So definitely tracking that and finding the main culprit. What is causing it? Is it this? 9 times out of 10, it's usually lack of education, for the patients. So they're not understanding the instructions, not understanding the NPO status, no food, no drink after a certain time, and the proper preparation, for the surgery. But if you can nail that down, then you can definitely track that. And then the second question was
cancellations or
cancellation. First case on time.
Yeah.
Sorry, first case on time.
Yeah, I'm sorry for FCOTs. Yeah.
Same thing again. Track those first case delays. Your knee-jerk reaction is surgeons late, but not a lot of times, but sometimes it could be, staff are running behind because they're lacking resources to get things together. Maybe waiting on lab work to come back at the last minute. Could be anesthesia's delay, and then of course surgeon late. So track and see what that problem is, and then B, once you find out what that problem is, hold each individual accountable. Whether it's the nursing staff, if that's the problem, the anesthesia staff, if that's the problem, surgeons, if that's the problem, we need to figure out why they're late, and what can we do to improve that. Of course, holding everybody accountable. You should have a chief of surgery or CMO that can manage behaviors if it comes down to a behavior problem, that they're not showing up on time and it's causing a delay for the whole room. Most organizations can have a correctionary process for surgeons, just like they do with the staff. Finding out why they can't be there on time, why if it comes down to correction action that needs to be held, holding your first case scheduling privileges, allowing post first cases. It's a long process that you would go through on that side, and then that's definitely a peer-to-peer, a surgical executive committee or CMO or chief of surgery, and then having that opportunity to have that conversation. But first case on time is almost as detrimental as case cancellation. If you're late, the room's late for the rest of the day. And if you got other surgeons following you, then it makes for a lot of unhappy surgeons. So definitely tracking and then holding each other accountable. Well, improved volume growth is making sure that you have all the resources, you have the time available, and that you can meet that demand. So whether it's, depending on what type of shop you have, if it's a Monday through Friday surgery center type shop, then you're going to be limited, after hours and weekends and things like that. So you got to make sure that your throughput is sound, and you can maximize the time available. Major ORs where they have 24/7 capability, do you, if your utilization is good, do you look at increasing the length of the day? You look at opportunities on Saturdays, and some places have a opportunity to do some scheduled cases, elective cases on Saturday to meet that demand. It could be on-demand type of thing, or it could be a scheduled type of schedule. But it all goes back to that utilization. We know the volumes out there. Patients are now definitely coming back into the hospital arena, to the medical arena. Many states have expanded Medicaid, so you're going to see a lot of additional volume. But patients will now be able to afford health care and seek treatment when needed. So it all goes back to that, making sure that utilization is sound and you're maximizing access to the OR. That's a great question. So you want to make sure that they're able to manage the day-to-day, of course, manage emotions, because as a manager or director or whatever, you go through a lot of emotions during the day. You got to be able to keep at an even keel and not have a lot of knee jerk. Make sure you take a deep breath and think about things before you react, because you'll be coming. A lot of people come at you in a lot of different directions. So the ability to maintain composure and calmness will go a long way versus automatically reacting to every situation. Everybody's made that mistake. I've made it. Before you make a decision, before you react to something, make sure you're thinking about how that's going to come across. I think that's where a lot of new leaders get taught. They automatically react to a situation, and a lot of times it can go badly, because like anything, there's always two sides to the story, and make sure you don't overreact to one side before you hear both sides. I think that's probably the biggest thing that you can learn as a new leader coming up through the ranks is being able to maintain composure and maintain that level of calmness. Staff's looking at you all the time. If you're overreacting, your senses are over heightened at most times, and you look out of control or out of composure, they're going to take on that same mentality person. They're going to start to overreact, because your staff take on your personality. If you're calm, cool, and collected, most of the time they're going to not overreact and go down the wrong path.
Well, that concludes our interview, and thank you so much for joining us today.
Sure. Thank you. Enjoyed it.